Today we are going to discuss monoamine oxidase inhibitors. So, for that we should know what is the function of monoamine oxidase. This monoamine oxidase or MAO is a mitochondrial enzyme or enzyme which is present in the mitochondria. And what is the function of this monoamine oxidase? This monoamine oxidase involved in the oxidative deamination of biogenic amines. What is the function of monoamine oxidase? It is involved in the metabolism of biogenic amines or oxidative deamination of the biogenic amines. Now, what are the various biogenic amines or which are the biogenic amines? Adrenaline, noradrenaline, dopamine, serotonin. These are the biogenic amines. So, oxidative deamination or metabolism of biogenic monoamines. This is the function of monoamine oxidase. So, there are two isoenzymes of monoamine oxidase: monoamine oxidase A and monoamine oxidase B. So, this monoamine oxidase A preferentially deaminates serotonin and noradrenaline, and this monoamine oxidase A found in the peripheral adrenergic nerve ending, intestinal mucosa and human placenta. And this monoamine oxidase B isoenzyme preferentially deaminates phenylethylamine, and it is found in brain and platelets. And this monoamine oxidase B, it is more selective for dopamine metabolism. Okay, so this monoamine oxidase A preferentially deaminates serotonin and noradrenaline. Means this monoamine oxidase A is concerned with depression, and monoamine oxidase B, which is more selective for dopamine, so it is concerned with Parkinsonism. Dopamine actually it is degraded equally by both isoenzymes. Liver contain both the isoenzymes like monoamine oxidase A and B. So as we can see, if we use monoamine oxidase inhibitors, so monoamine oxidase A inhibitors are used in the treatment of depression. Monoamine oxidase B are used in the treatment of Parkinsonism, because this monoamine oxidase A is responsible for oxidative deamination of noradrenaline and 5-hydroxytryptamine. Monoamine oxidase B is more selective for dopamine metabolism. Okay. Now, how will you classify this monoamine oxidase inhibitors? Non-selective. Non-selective, tranylcypromine, phenelzine, isocarboxide. Selective monoamine oxidase A, Moclobemide, chlorgyline. They are used in depression. Selective monoamine oxidase B, siligilin, which is used in Parkinsonism. Okay. So monoamine oxidase A inhibitors, possess antidepressant property. Siligilin selectively inhibits monoamine oxidase B at lower doses, 5 to 10 mg per day, but these are not effective in depression, they are effective in Parkinsonism. But when this siligilin is metabolized to the amphetamine and at higher doses it becomes non-selective monoamine oxidase inhibitor, it exhibits antidepressant and excitant properties. Now, this non-selective monoamine oxidase inhibitor elevate the mood of depressed patient. They elevate the mood of depressed patient, and in some cases it may progress to hypomania and mania. Means it will elevate or elevate the mood of depressed patient, and in some cases it may progress to hypomania or mania. Excitement and hypomania may be produced even in non-depressed individuals or in normal individuals. Now, this non-selective monoamine oxidase inhibitor, they inactivate the enzyme irreversibly. And that's why these drugs are called as hit and run drugs. Hit and run drugs means this drug bound with this monoamine oxidase enzyme, and it will inactivate the enzyme irreversibly, so that return of monoamine oxidase activity depend upon the synthesis of fresh enzyme. Means till the formation of new enzyme or fresh enzyme, monoamine oxidase activity will not going to return. Why? Because it will inactivate the enzyme irreversibly, and if it will inactivate the enzyme irreversibly, tissue monoamine levels means level of dopamine, serotonin remain elevated long after the drug has been largely eliminated. Though the drug has been largely eliminated or excreted from the body, but still the action will remain there in the body. Why action will remain there in the body? Because they are hit and run drugs. Though the drug is excreted from the body, action is still there. Action is still present. Why? It will inactivate the enzyme irreversibly, so that return of monoamine oxidase activity, when it will return? When the synthesis of fresh enzyme occurs. And when the synthesis of fresh enzyme occurs, then only monoamine oxidase activity will return. Till then, till that, there will be no monomer oxidase activity. That's why, though the plasma half-life of these drugs is short, but duration of action is longer. Why? Because it will inactivate the enzyme irreversibly. Now after that, cheese reaction. Now what is this cheese reaction? Certain varieties of cheese or beer, wines, pickled meat, yeast extract, fish, they contain large quantities of tyramine. So, what is the function of monoamine oxidase? Monoamine oxidase also required for metabolism of tyramine. It is essential for metabolism of tyramine. So, in monoamine oxidase inhibited patient, in depression patient, if that particular patient is on monoamine oxidase inhibited, that particular patient is taking that monoamine oxidase inhibitor. So these indirectly acting sympathomimetic amines. What is tyramine? It's a indirectly acting sympathomimetic amine. They will escape degradation in the intestinal wall and liver. What will happen? It will escape degradation in intestinal wall and liver. And so that more and more tyramine will reach to the systemic circulation, and they displace and release large amount of noradrenaline from transmitter loaded adrenergic nerve ending, and because of that it may lead to hypertensive crisis or cerebrovascular accident, and that is called as cheese reaction. Means if that particular patient of depression is on monoamine oxidase inhibitor, and if that patient will consume cheese, beer, wines, pickled meat, fish, means those food contains high amount of tyramine containing food. So he or she may land up in a cheese reaction, and that cheese reaction is nothing but the hypertensive crisis or cerebrovascular accident or stroke. So how will you treat this condition? You can treat by giving intravenous injection of rapidly acting alpha blocker phenoxybenzamine, phentolamine, selective alpha 1 blocker, prazosin, or you can also give chlorpromazine, which is a typical antipsychotic. Now here you can better understand. In a patient of depression who is on monoamine oxidase inhibitor, if he or she will consume large amount of tyramine containing food like cheese, fish, meat, beer, wine, yeast, they are rich in tyramine. So that tyramine will escape from degradation. Means usually that tyramine is degraded by monoamine oxidase, but if patient is on monoamine oxidase inhibitor, so there will be tyramine escape degradation, which is in the liver and gut. If that tyramine escape degradation in the gut and liver in patients on monoamine oxidase inhibitor, so what will happen? Tyramine reaches systemic circulation. More and more tyramine will reaches in the systemic circulation because it will not degrade. So displaces large quantities of noradrenaline from sympathetic nerve ending, and that may lead to increased blood pressure, which may lead to hypertensive crisis and cerebrovascular accidents or stroke. Now, we have reversible inhibitors of monoamine oxidase A, that is REMA. Moclobemide is a reversible and selective monoamine oxidase A inhibitor. It has shorter duration of action. Why shorter duration of action? Because it will inhibit that enzyme reversibly. Okay, full monoamine oxidase activity is restored within 1 to 2 days after stopping the drug. Because of competitive enzyme inhibition, tyramine is able to displace it from the enzyme. Tyramine is able to displace it from the enzyme because of competitive enzyme inhibition. So that potentiation of pressure response to ingested amine is minor and dietary restrictions are not required, means the patient who is on moclobemide or chlorgyline, there will be no cheese reaction. It lacks the anticholinergic, sedative, cognitive, psychomotor, and cardiovascular adverse effect of typical tricyclic antidepressants, and it is safe in overdose. Now, what are the adverse effects of this moclobemide? Nausea, dizziness, headache, insomnia, rarely excitement, liver damage. Moclobemide is an alternative to the tricyclic antidepressant for mild to moderate depression and for social phobia. Dose is 150 milligram twice a day or thrice a day, and maximum you can give 600 milligrams per day. So this is all about monoamine oxidase inhibitors.